Bismillahirrahmanirrahim. Today, I'm going to go through the second question of that series of quiz which we are doing along in relation to hypertension. In the first quiz, we dealt with methodology of checking blood pressure, and that's already available. Today, we'll start again with the same. We'll give you a question and want you to answer. So I'm just about to I'm just going to share the question with you. That this is a question in relation to hypertension. You're seeing on screen that of the following, which is the most common cause of secondary hypertension? That means today we are going to cover the etiology of hypertension. Although most of the time it is essential, almost 90 to 95% of the time it's essential, that is without any reason. But sometimes you may have some secondary cause associated with hypertension. So what I am showing you four options there: hyperthyroidism, hypothyroidism, obstructive sleep apnea, aortic coarctation. And want you to think of an answer which is the most commonest out of these four. We're not saying that this is the commonest. Out of these four, which is the commonest? Let's see if someone has, it may not be the right answer, that has clicked hypothyroidism as cause of secondary hypertension. Let's see the right answer, and then we'll go about it, what to do in that situation. Now here is the right answer. The right answer was obstructive sleep apnea. Out of these four, hypothyroidism wasn't a right answer. Since we raised this issue of secondary hypertension, that is etiology, I'll just want you to revise or go through the objective of assessments when you are dealing with a patient who has newly diagnosed hypertension or high blood pressure. These are the four objectives you have to achieve in your patient. First, the confirmed diagnosis, for which you have to measure your patient's blood pressure very accurately, consider all the additional reactionary features which may increase blood pressure transiently, which you have to exclude, at least have to monitor home-based reading, 24-hour blood pressure monitoring, and then finally conclude that a person who's having high blood pressure is hypertensive or not. Second, always search for etiology. Although 90% of the time it's essential without any cause, but 5 to 10% of the time it may have any secondary reason to that. And once you take care of that, you'll correct or take care of the blood pressure of your patient. Always assess for complications. We know all the common complication blood pressure can have. High blood pressure can have acute or chronic. Always assess for other comorbidities, and we'll cover these things in further quiz because we are remaining with 3 more questions. This is the second question today I'm dealing with you. And let's come to the common causes. Essential, we all know. Secondary can be persistent, can be even transient causes. Sometimes drugs or even transient causes can cause increase in blood pressure for a temporary period of time that you have to take care. Let's come and see the commonest and uncommon causes. Although, if you look here, the commonest cause is renovascular and renal parenchymal. So renal disease is one of the commonest one among the secondary causes that you have to always exclude when you're dealing with a patient with high blood pressure. And there are certain clues towards secondary hypertension, that if blood pressure is resistant, it's not controlling on 1 or 2 medication, pre-existingly controlled blood pressure suddenly becomes uncontrolled, if you have a high blood pressure at 2 extremes of ages, and if you are getting some clues towards secondary hypertension, that means in history and examination, you have to go through the common clues towards these things, and in preliminary investigations as well. So here we can say the commonest primary aldosterone, drugged alcohol, and uncommons as well: pheochromocytoma, Cushing, hyperthyroid, aortic coarctation, primary hyperparathyroidism, congenital adrenal, and these all. So that means today we have covered something about etiology, and hope this quiz will also help you. Now, these are just a pointers, these small videos, and it really compels you and given an initiator to you to go and read on this subject comprehensively. In first quiz, we covered methodology of checking blood pressure, and in this second quiz, we have covered etiology. Go and read comprehensively their common clues and everything, and hope that will help you in your future.